Okay, thanks so much for joining us on The Bright Side. Once again, we've been talking about the electrical nature of the body. I call it the electrical energy train of health. The relationship between oxygen and electricity and nutrition. When I say nutrition, by the way, I'm also including water. So water and the mighty 90, nutrients, oxygen and electricity. I haven't told you yet where the electricity actually comes from. We'll be talking about that here in a little bit. Before I get into all this electrical stuff, I want to touch on a few of the really basic fundamental ideas of what I call the bright side philosophy. We've had a lot of new listeners over the last month and a half. I've been on Alex, and people have been listening to, watching the YouTube videos, the 8 chapters videos. There's a couple of YouTube videos out there. And so I'm getting a lot of questions about some of these fundamental ideas. I thought maybe we should go back and digress just a bit and review some of the fundamentals of what I've been calling the bright side philosophy, the idea that the body heals itself. It's a renewing, healing system. As long as it has what it needs, and as long as we don't muck it up, as long as we don't monkey wrench the system with toxicity, which unfortunately includes the insidious, sneaky, doctor-induced toxicity of pharmaceuticals and drugs, in addition to the crap we call food and the crap we put on our food, as well as poor lifestyle choices like smoking cigarettes, drinking excessive amounts of alcohol. These are all the ways we muck up the healing system of the body. If we don't muck up the system, the healing and renewing system of the body, and we give it what it needs, the body can heal itself. The body knows what it's doing, folks. Give it the mighty 90. Give it the raw materials it needs to do its work. The electrical train of health, oxygen through deep breathing, good foods, good protein, good carbs. By carbs, I'm talking protein, talking fats and sugars. Protein, fats, sugars, the mighty 90. Don't muck up the system. The body can do what it needs to do. It doesn't need any help from your doctor. It doesn't need any help from your pharmacist. It doesn't need any help from your insurance company. What it needs is raw materials, and it needs to not have us muck it up. So first of all, the most important thing is the health challenges and the health crises that so many of us are dealing with are best described as being degenerative. Degenerative. That means not generating, not building. But as we say every day on The Bright Side, at the beginning of every program, the body's a healing system. It's a healing biological system. It's in the body's nature to heal. It's in the body's nature to regenerate. So if we are degenerating and not regenerating, something's wrong. Either something's missing or something's getting into the system that shouldn't be in the system, or a combination of the two, period. That's it, folks. If you are dealing with arthritis, osteoporosis, cardiovascular disease, any degenerative disease, all you need to do is replace or put in what's missing and eliminate the monkey wrench. That's it. At this level, it cannot get any simpler, and there's no doctor that can help you. And if a doctor purports to help you with your health, he's lying to you and he's ripping you off. This is not a doctor issue, people. This is our issue. And it can't get any simpler. Nutritional deficiencies and toxicities are most likely a combination thereof. Now, from a mechanical standpoint, the breakdown of the body that results in nutritional deficiencies and toxicities, or results from nutritional deficiencies and toxicities, involves 3 body systems: the digestive system, the blood sugar system, and the energy control system. The digestive system, the blood sugar system, and the energy control system. I'm calling the adrenal glands and the thyroid glands, or the adrenal thyroid complex, the energy control system. These are the 3 systems that break down first in the body. I've been calling it the triangle of disease: the digestive system, the blood sugar system, and the energy control complex, which is the adrenal glands and the thyroid. Cancer, heart disease, autoimmune disease, skin diseases, psoriasis, acne, osteoporosis, joint disease, muscle disease, brain disease, nerve disease are all secondary. They all follow the primary fundamental points of breakdown, which simply means there is no cure for cancer or heart disease or arthritis or multiple sclerosis or any autoimmune disease or juxtafoveal telangiectasia or hyperhidrosis superintiva or RLS or RSD or PMS or any of the other alphabet soup of diagnosis and ignorant medical professional names that that doctors bill us for and bill our insurance companies for, there is no relief from any of these without addressing these fundamental points. And this is great news. This is the bright side. This is such good news because it takes the ball out of the doctor's hands and it puts it in ours. It takes power and medical authority from those who have stolen it or ripped us off from it, or more accurately conned us out of our own power, and it puts it back in our hands. I know there's some nice, kindly, well-meaning doctors. There's even some smart doctors out there. There's some very in-tune medical professionals. I am aware of that. It's the model that is tweaked. It's the model that's messed up. And if you get hit by a car, you want a surgeon, not a vitamin. If you get hit by a car, you don't need vitamin C. You don't need a nutritionist. You need a good surgeon. But the idea of ambulatory medicine, which is the kind of medicine where you walk into a doctor's office, to ambulate means to walk. The idea of ambulatory medicine, where you go to the doctor for day-to-day medical intervention for your high blood pressure or for your benign prostatic hypertrophy or for your migraine headaches, where you go into a doctor's office for treating something that's a degenerative, chronic, long-term disease where you're going to be going to the doctor for the rest of your life or taking a medication for the rest of your life. This is an authority trip. It's a power trip designed to rip us off, to steal our power and authority and money. And it's exactly the same as religious tyranny, and it's exactly the same as government tyranny. Medical tyranny is no different from any other tyranny. That's why the Founding Fathers included the medical industry of the time in with government tyranny and religious tyranny when they framed the Constitution. There's some wonderful quotes from Thomas Jefferson and Benjamin Rush, who himself was a medical doctor. We'll tell you what that is. We'll tell you what they are when we come back from our break. I'm Pharmacist Ben. You're listening to The Bright Side on the Genesis Communication Network. We'll be back right after this. We're talking about this, what I call the foundational idea of the bright side, the triangle of disease. The body breaks down sequentially. Digestive system breaks down first. The blood sugar system breaks down second. The energy complex system, which is the adrenal glands and the thyroid, break down third. And it's not a doctor issue, but a doctor will tell you it's his issue because doctors like power. And this is why even centuries ago, 250 years ago, Thomas Jefferson, referring to the American people, said, if people let the government decide what foods they eat and what medicines they take, their bodies, this is a quote, by the way, direct quote, if people let the government decide what foods they eat and what medicines they take, their bodies will soon be in as sorry a state as are the souls who live under tyranny, unquote. Thomas Jefferson. Now, this is a link that the Founding Fathers made with government tyranny, between government tyranny and medical tyranny. Tyranny is tyranny is tyranny. It's taking power away from you and me, taking power away from the citizens and putting it into some kind of authority system. Whether that authority system is government, whether it's police, or whether it's doctors. Thomas Jefferson was no dummy, and he knew this 250 years ago. Benjamin Rush, another signatory to the Declaration of Independence, himself a medical doctor, Dr. Benjamin Rush said, quote, this is 250 years ago, folks, quote, to restrict the art of healing to one class will constitute the Bastille of medical science. In other words, it will destroy medical science. All such laws are un-American and despotic, as in tyranny. A despot is a tyrant. Continuing, unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship. Hello, people. Does this sound familiar? The time will come when medicine will organize into an undercover dictatorship and force people who wish doctors and treatment of their own choice to submit to only what the dictating outfit offers. That's a fancy way of saying doctors and the medical model will steal power every time they can get it. And this is Dr. Benjamin Rush talking in the 1700s, the late 1700s. What they were talking about, what these wise, prescient founding fathers were talking about, is exactly what is occurring today, and unfortunately with our complicity, with our volition. We are letting them do it to us. We are living in the medical tyranny that these founding fathers warned us about 250 years ago, except for we are shockingly, voluntarily submitting to, even honoring our slave masters, even deifying this authority system. And what good has it done? We are the sickest culture on the planet, despite our medical deities. We are the sickest culture in the history of the planet, despite our medical deities. Despite the supposed advances of medicine, 100 million Americans are obese or overweight. 100 million Americans have diabetes and degenerative diseases. More if you include degenerative diseases. But you know what, folks? The good news is we can take back our power. We can live fully and completely without ever having to walk into a doctor's office ever, except for, God forbid, some kind of trauma. We can, as my friend Dr. Glidden says, fire our MD. We should fire our MD. Have you ever heard of a doctor curing anything? Have you ever heard of a doctor curing diabetes? No. They tell you you're going to be on your prescription drugs the rest of your life and keep eating your snack foods and make sure it's low fat. That's doctor wisdom. In fact, if you do ever step into a doctor's office for anything other than getting hit by a car or some kind of accidental acute trauma, you are, in fact, implicitly and explicitly and literally giving up your power and self-governance. If you do something or take something because they told me I had to take it, they got mad at me. I hear this all the time. My doctor got mad at me because I didn't want to take the medicine. Because I didn't want to take my poison, my doctor got mad at me. I hear this all the time. If you take something because my doctor told me to, or they put me on medicine, you have given up your power, you have given up your authority, you've let them infantilize you, and you've given up your ability to be self-governing about the most fundamental aspect of governing itself, which is health, our bodies. If, on the other hand, you're dealing with a chronic degenerative disease, and it's obvious to you, as it should be, that the idiotic medical model of surgery and steroids is not helping you, here's what you need to do. It's simple. Return to the triangle. Return to the triangle of disease. Backtrack to the triangle of disease. No matter what your health condition is, given that it's a degenerative disease, degenerative health condition where the body's falling apart, return to the triangle. Start with the digestive system. Always, 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 degenerative disease is secondary to digestive distress. Degenerative disease is secondary to digestive distress. The body's like a circle. It's closed. There's no way to get inside a circle. That's the definition of a circle. It's closed. Technically, we call it a closed system, except in the body, there's three little portals. There's three little portals technically, but for practical purposes, there's only one portal into the circle. There's only one way into the body. There's only one way into the circle that we call the body. The body's pristine. The body's perfect. There's only one entryway into this circle of this closed system that we call the body. There's only one practical way for anything to get into this closed system to disturb it. There's only one doorway, window, portal into this circle, and that doorway, opening, window, portal into this circle is through food and digestion. Yes, you can get stuff in through the nose and the skin. Technically speaking, these are routes into the circle, but by far and away, the most likely port of entry into this pristine circle, this holy, sacred, divine space that is called the human body, the only way into it, the only way inside the body is by what we put in our mouths and what we are eating. Over time, as wrong things get into this pristine, holy, sacred space of the body, the digestive system becomes inflamed, the digestive tract becomes irritated, it begins to break down, and once this pipe that we call the digestive system breaks down, you have begun the degenerative process, and it begins to occur shockingly early. At birth for many people, prenatally for some people, in the womb for some people, certainly by the time most of us are 2 or 3 or 4 years of age, if we're indulging in the standard American diet, we have begun the digestive breakdown, and the road to degenerative disease has been initiated. And at that point, complete healing and reversal cannot occur. And this is why we get put on drugs at a very early age. This is why it's so important to know the effects of what we're eating, to notice digestive symptoms, and then to link them with foods. There's so much more to talk about here, folks. I want to continue talking about the triangle tomorrow. I still want to talk about the electrical nature of what we eat. We don't eat for food. We don't eat for the solid stuff. We eat for the electricity. And we'll be continuing to talk about this in the coming days on the bright side. We're coming back with your phone calls right after this, folks. Don't go away. All right. We'll continue talking about the triangle and the triangle of disease and electrical food, electrical nutrition, if you will. The electrical nature of health. We'll continue that discussion over the coming days. So you're going to want to tune into the bright side in the next few days, at least, if you're interested in reversing the degenerative disease process, which is simple to reverse. Once you remove the bad stuff and put the good stuff back in, we'll be continuing this discussion over the next few days. 855-660-4261. Time to hit our phones. Let's go to Rick in Illinois. What's going on, Rick? Welcome to the bright side.
Good morning, Ben. Thanks for taking my call.
Sure.
I was the final caller on last Friday's show and didn't get to finish up, so I'll start over again.
Okay.
Here. I have tinnitus in my left ear, and although it is a problem I'm trying to resolve, it's not the primary reason why I'm calling you today.
Okay.
I saw my ENT on February 5th to have my ears cleaned, which I do at least annually. I saw my GP on February 13th for persistent cough and what felt like chest congestion. He noted that he saw fluid buildup behind my left eardrum, which explained why I'd been hearing a rustling sound in the left ear and why it felt like it was blocked. He also noted that I had post nasal drip, which was a likely cause of the persistent cough and the congested feeling in my chest. My question for you is, what might have caused the fluid buildup in my left ear, and is there a way, or is there anything from a supplement or a diet standpoint that may help the fluid drain from my eustachian tube so I can determine if this fluid buildup is exacerbating my tinnitus, which has been a little bit louder than usual?
Okay, here's the deal. Now, a couple things. When you say you had your ears cleaned, you mean the ear canal, not the... They clean it with like a Q-tip kind of thing? Is that what you're talking about?
No, I think they clean the ear canal just because wax build up over time.
Okay,
and,
so what you're
talking,
those are two different issues, Rick. The ear canal is not related to the fluid buildup. Fluid buildup is behind, as you said, behind the eardrum. You have a tube that runs into that area. It's called your eustachian tube. And that eustachian tube is where pressure is sensed. The body, that whole inner ear area is very complicated, and it works via air and fluids that fill up and are controlled via valves in that tube, the eustachian tube. And when you have inflammation in that area, it can throw things off. Everything you're saying, from the cough to the post nasal drip to the fluid buildup to the tinnitus, everything you're saying is screaming immune system. It's screaming inflammation. It's screaming something is getting into your body that's causing leakage. Let me explain how this whole leakage thing is related to the immune system. You have a circulatory system, your blood, and you have fluids, and you have lymph, and all of that is kept in a tube. Okay, the tube could be your lymph tube, it could be your blood vessel tubes, it could be the eustachian tube in the ear. So the fluids are always flowing through tubes. Does that make sense so far?
Yes.
Okay. When you have an immune reaction, that is when the body is defending itself, the army, your body's army, your defense system, is called white blood cells. The white blood cells are the army. And they live in these tubes, whether it's the lymph tube or whether it's the blood tube. They live in these fluid tubes. And when you have something that gets into the body, and the body says, oh my God, there's an enemy in the body, we've got to mobilize the army, we've got to release the soldiers, the tubes will all begin to open and the fluids will leak out. Does that make sense? Okay, let me explain. It's very important. I want this to make sense, okay? The army is the white blood cells. Okay, that makes sense, right? The army, the soldiers, are the white blood cells. They're the ones that are going to attack the enemy, whether the enemy is a food you shouldn't have eaten, or whether the enemy is a bacteria or the virus or a pollen or something that got in the system. The body fights these things with what are called white blood cells, and the white blood cells can be thought of as soldiers of the army. Are we good? Yeah. I want this to make perfect sense at every step of the way. So I'm going to go over it. I'm going to go over it in as small steps as possible. So stuff gets into the body. The body says, enemy in the body. We got to get the army out. We got to get the soldiers out. The soldiers are the white blood cells. So we're so far so good. You got to help me here, Rick. You got to say yes or no.
Yeah, I'm saying yes. Can you hear me?
Okay, good. Okay, good. Got it. Okay, now how does the army get out of the blood vessels and the lymph vessels? The lymph vessels and the blood vessels open up. They open up and they start to develop openings like pores, little circles, and the army starts to leak out. And along with that leakage out of the vessels, the blood vessels and the lymph vessels, you get fluids. So as the white blood cells are leaking out of these fluids, out of these tubes, the fluids are following. And now you have white blood cells and you have fluids in areas there shouldn't have fluids. And this is all in response to something that's getting into the system. The system basically becomes leaky in an attempt to get to the area to attack and prevent the area from doing damage, or for the invader from doing damage. This leakage, what you're experiencing as coughing and as fluid buildup and as blockages and even as tinnitus, is a result of leakage into the eustachian tube, into the ear area, the inner ear area, even into the respiratory tract because you're coughing, of leakage secondary to the body attempting to fight something off. The body is attempting to fight something off. This gets back to the idea that we were talking about earlier. Nothing goes wrong in the body unless something gets in that shouldn't be in. I don't know how much simpler I could be. Your inner ear problems, your eustachian tube problems, your tinnitus is arthritis of the ears. It's osteoporosis of the ears. Your problem is exactly the same problem as any other inflammatory issue, except yours is happening inside your respiratory tract and in your sinuses. But it's the same problem. You understand? It's a different flavor, but it's the same food. It's the same problem. It's immune activation and inflammation. When you have immune activation and inflammation, whether it shows up as an inflamed joint or whether it shows up as inflammation in the inner ear or whether it shows up as inflammation in the respiratory tract, something has gotten into your body that shouldn't be there. Now, where could that be from? By the way, does that make sense so far?
Can I jump in and mention a couple things?
Well, first tell me if that makes sense. Something has gotten into your body that shouldn't. Does that make sense to you?
Yes.
Okay. What were you going to say?
Well, I wanted to add one thing.
Sure.
I don't know if it relates to this. I'd been under what I call chronic stress for several years.
Yeah.
And it peaked to, in early 2011 to a point where I was, virtually bedridden for several. I'd have to go to bed several times a day because I felt so bad. I've rebounded, and I feel much better today.
Well, that certainly didn't help. That didn't help, but that's not causative. That's not causative. It's not helping. That may be exacerbate the situation, but it's not causative. That's not going to trigger an immune response. It may make an immune response more prolonged. It may slow down the healing process, and it probably does, but it isn't causative. I'd be looking at something that's getting into your system that shouldn't be. Now, I'll tell you this. It's very unlikely that you don't have something going on in the digestive tract, like some kind of symptom, heartburn, bloating, gas, cramping, diarrhea, constipation. You may not know it. As we've said many times in this program, the brain doesn't always notice these things if they happen all the time. But it's very unlikely for you to have this kind of significant issue, this prolonged significant issue, without having something that you're noticing in the digestive tract. Now, it's in your interest to find it, because then it's much easier for you to start to eliminate things. Pretty much the only place something is going to get into your system is going to be through foods, although occasionally you could have some kind of a seasonal allergy type of thing, especially if you're dealing with an inner ear or respiratory problem. Obviously, you're breathing stuff into your head and into your sinuses. So a couple of things for you. Number one, please focus on the digestive system. Focus on foods. Focus on problem foods. Focus on digestive symptoms and link them to potential foods. We spent almost 2 weeks, a month or so ago, talking about lectins. Hang tight, Rick. We got to take a break. I want to finish this up when we come back. If you're on hold, stay there. We'll try to get to all your calls today. 855-660-4261 is our number. I'm Pharmacist Ben. You are listening to The Bright Side, and we'll be back after this. All right, we're back on The Bright Side talking to Rick in Illinois at 855-660-4261. Rick, you there, bro?
Yes, I am.
Okay. So everything you're saying, whenever I hear fluid buildup anywhere, fluids, I'm thinking the immune system. As I explained before, blood vessels and lymphatic vessels that are supposed to keep fluids flowing within pipes, if you will. The circulatory system's like tiny little pipes, and fluids flow in there. When the body needs to attack something, it'll open up or expand those pipes, and pores, little openings will form in those pipes, and fluids will leak out. The reason fluids leak out, this is why we become inflamed, really. This is how rosacea, for example, that's a classic example of this vasodilation secondary to some kind of attack on the body. What you're experiencing, by the way, is rosacea of the ears, rosacea of the inner ear, rosacea of the eustachian tube. It involves fluid buildup. It involves expansion of vessels, all secondary to something getting into the system. It is so important, Rick, for you to see if you can link up specific foods to digestive system symptoms. That is heartburn, bloating, gas, diarrhea, constipation, loose stools, etc., etc. Now, if you can't find any digestive symptoms, and keep in mind, it's in your interest to find them. It's much easier to eliminate problem foods if you can link them to digestive symptoms. If you can't, then link them to your inner ear symptoms. Link them to the fluid buildup. Link them to the blockages, the sensation of blockages. Link them to the coughs. Link them to the tinnitus. Tinnitus it's all the same idea, and you're very attuned to notice that your tinnitus has gotten worse as the inner ear has become more leaky and inflamed. So number one, focus on problem foods, things that are getting into the system that shouldn't be. And then number two, start to strengthen and build up the digestive system. We'll talk about the immune system here in a minute. You want to strengthen and build up the digestive system. Probiotics are your best friend. I would be getting the best probiotic supplement I could find. I'd be getting it today. Call 866-735-2470. Tell them you want the nightly essence and start to take 80 billion units a day. If you don't want the nightly essence, find one you like, but take 80 billion units a day. Start eating fermented foods, sauerkraut, miso, tempeh, kefir. Anything fermented is going to be in your digestive tract's interest. Secondly, get yourself on glutamine powder. Wonderful for the digestive system. Glutamine is like fuel, or provides fuel. It gets turned into fuel for the cells that line the intestine. For digestive tract cells, so-called enterocytes. Glutamine is fuel for your enterocytes, for your intestinal cells. I'd be doing 5 grams or a teaspoon of glutamine powder every day. Get on the Z radical. The Z radical can protect your digestive system from lectins, which we talked about a couple of months ago, of how lectins are involved in damaging the food system, the digestive system. Gluten is a classic example of a lectin, and gluten intolerance is a lectin intolerance disease. So the Z radical may help you. I'd be using the digestive enzymes, which can have a double effect. Number one, obviously, they can help you with the digestive system. Number two, they can help you with any kind of inflammation that's going on. It sounds like there's some inflammation in the inner ear. You want to take the digestive enzymes on an empty stomach in order to exploit their anti-inflammatory effects. And then you want to take the digestive enzymes with food if you want to take advantage of their digestive support effects. You want to use apple cider vinegar after meals. It wouldn't hurt you to take a little bit of lecithin with fatty foods. And then for directly supporting the immune system, there's wonderful nutritional supplements. Probably vitamin C is the most important. I'd be using high doses of vitamin C. One of the neat things about the Beyond Tangy Tangerine is that you get a high dose of vitamin C, 1,000 milligrams in 2 scoops, but you also get it with vitamin A and the B complex and other nutrients that can help support health and support the immune system. So I would be using the BTT, or if you want to just use straight vitamin A and then get your other nutrition from another source, vitamin C, use 1,000 to 2,000 milligrams minimum of vitamin C a day, but you can take up to 5,000 to 10,000 milligrams of vitamin C. The mineral zinc has got a couple of neat benefits. Number one, it's one of the most important, if not the most important, mineral for the immune system. Selenium is also important. I'll tell you about that here in a minute. But zinc is also very helpful for the digestive system, and zinc can be also helpful for the inner ear. In fact, zinc is known as one of the remedies. I don't like necessarily nutritional remedies, but zinc is considered to be a remedy for tinnitus. So 50 milligrams of zinc a day might be something to think about. Selenium is also a very important mineral for the immune system. I'd be using 400 to 600 micrograms of the the ultimate selenium from Longevity. And then your fat-soluble vitamins are also going to be very important. Take them with fatty foods, with meals, with apple cider vinegar, with your ultimate enzymes. And by fatty nutrients, I'm talking about vitamins D, E, A, and K, especially vitamin A. There's a very important relationship between vitamin A and zinc. Deficiencies in one can cause deficiencies in the other. Take them both together. Vitamin A, I'd be using 20,000 international units a day. Vitamin E, around 400 IU a day. Vitamin D, get it from the sun, or if you want to supplement, 5,000 is a good place. 5,000 milligrams is a good, IU, I think, on vitamin D is a good place to be. And then vitamin K is around 5,000 micrograms is a good dose of vitamin K. And then if you really want to go all out, my friend, get some vitamin B12 injections in addition to getting on a good B complex vitamin. The BTT will get you all your B complex, but a vitamin B12 injection might be helpful. There's tons of ways you could go, but please, my friend, focus on the digestive system, focus on inflammation, focus on the immune system and stuff that's getting into the body that shouldn't, and link your foods up to digestive symptoms if you can. Thanks so much for your call. Appreciate it, Rick. Moving on to Texas, and let's say hi to Kevin. Welcome to the bright side, my friend. What's going on?
Wife has a number of medical conditions, but she's concerned about her gallbladder. It's functioning at 39%. She wants it removed, but the doctor tells her it's fine, even though nurses have told her if it's below 50%, it needs to be removed. And what can she do to stop stop having the pain she's feeling and maybe get that much more functioning?
All right, good question. Hundreds of thousands of gallbladders are yanked out of people, butchered out of people's bodies every year. If she voluntarily wants to have her gallbladder removed, I don't know what to tell you. That's just craziness. Obviously, we all have the right to have our bodies hacked up if we want, and if she wants to remove her gallbladder, more power to her. That's her right. However, if you don't want your gallbladder removed, you don't need to have your gallbladder removed, and please don't let anybody tell you you don't need your gallbladder. Believe it or not, I hear doctors say it all the time that you can live just fine without a gallbladder. I've heard physicians say many animals live just perfectly with no gallbladder at all, as if that means that human beings can live fine without an organ that they were born with. You need everything in there, people, including your gallbladder. The gallbladder is a bag. The word bladder means bag. The word gall means bile. So gallbladder is bile bag. It's a bag o' bile. It's a bag filled with bile. What is bile? Well, next to blood and lymph, bile is probably the most important fluid in the body. Bile is responsible for helping the body process fatty materials, fatty vitamins, essential fatty acids, fatty phytonutrients, fatty nutrients that are found in plants, carotenes, and flavonoids. Without a gallbladder, you are at risk for malabsorption for all of these. Malabsorption of vitamin D, malabsorption of vitamin E, malabsorption of vitamin K, malabsorption of vitamin A, malabsorption of all your minerals because your minerals need bile too. Oh, there's more. Malabsorption of carotenes, malabsorption of flavonoids, hormone problems because hormones come from fats, and malabsorption of essential fatty acids. Now, does that sound like something that your friend wants to have? Did you say this was your friend or your wife, ma'am, or sir?
It's my wife.
Okay, does that sound like something your wife really wants to deal with? Malabsorption of all that stuff? I don't think so. So here's the thing. The gallbladder will get messed up when you are not processing fats correctly because bile becomes cloggy and sticky. See, bile starts off in the liver, it moves to the gallbladder, it moves to the small intestine, it goes into the large intestine, and then it goes back into the liver. Actually, it goes back into the liver from the small intestine, but regardless, it circles around. It goes liver, gallbladder, small intestine, some goes into the large intestine, some goes back into the liver, and then it goes back around. And over time, as we're not processing fatty material, that bile becomes sludgy and sticky, just like engine cleaner, just like STP engine cleaner becomes sludgy and sticky over time. Same thing with bile. When that bile becomes sludgy and sticky and thick and gooky, it clogs up the little tubes in the gallbladder that are supposed to squeeze that bile into the small intestine, and that's called gallbladder pain. And if the bile gets cloggy and sticky enough, it can actually form a stone that can stick in that little connection between the gallbladder and the small intestine, and that's called intense pain, serious pain. And that's when you say, take the darn gallbladder out because I can't deal with this, and that's very understandable. So what you want to do for bile, for a clogged up gallbladder or gallbladder pain, is you want to figure out why the bile is becoming sludgy and sticky, and it's usually due to something you're eating. Surprise, surprise, surprise. Nothing gets into the bile unless you've eaten first. So what you got to do is you got to link your bile problems, you got to connect your bile problems to digestive symptoms like bloating and gas and diarrhea and heartburn, and then link those up to foods and eliminate those foods. And I hate to do this to you, my friend, because there's so much more to say about this, and it's very important. I wonder if I get you to call back tomorrow, my friend. Kevin in Texas, can I get you to call back first thing in the morning or first thing tomorrow so we can get you? I hope we can, because this is very important. All right, I'm Pharmacist Ben. There's so much to talk about, and I hate running out of time, but we do every day. That's just the way it is on the bright side. Tomorrow we'll continue talking about the triangle. Maybe we'll get to some of the electrical nature of food and how important the electrical components of what we eat are. And then we'll finish up with Kevin's question about the gallbladder. All right, that's all for now. Stay tuned for Alex Jones next on most of these stations. We will talk to you all later, friends. Bye for now.